My name is Amal Nirgadkar. I'm the CEO of Patient Prism, and I'm having amazing conversation with Christina Villarreal about patient experience. And Christina is the patient experience manager at Dental Associates, which is one of our favorite clients up in Wisconsin. And she spends a tremendous amount of time as part of her job to help deliver great patient experience to all their patients across their offices. My question here is really, what is the greatest challenge really in implementing these strategies? Because it's not, I mean, it's kind of not easy to get any change done, right? But what do you see as the biggest challenge?
I think, well, one of the biggest challenges would be to make sure leadership buys in and promotes and advocates for, whatever strategy we are doing to improve the patient experience. It has to come from that, that very top leadership, that this is important, this is a priority.
Right.
Of course, our patients are the reason that we are here is to take care of them. But this is not, patient experience isn't fluff. It's vital. And if we're not providing our patients an amazing experience, they're going to go somewhere else. So
Okay.
I think just making sure that, leadership promotes that. To get those staff members engaged, and that would be the next thing, is really engaging those staff members to want to be a part of making these great things happen for our patients.
But the challenge-wise, I mean, when you start, like, okay, we're going to start doing this stuff, you're going to get some resistance from team members, doctors, hygienists, everybody, right? So what is that resistance? So what does that look like in terms of a challenge that you faced or you had to overcome?
Well, usually it's we don't have enough time. That's just going to take too much time. We're going to fall behind. It's just it doesn't take more time to care and to listen, really. And I think that's the most important thing. Being courteous and respectful in listening. You're not adding minutes to that appointment. You're doing it while you are with that patient. And I feel like that's always been the challenge with a lot of improvement initiatives, is like, we're just so busy. We're so busy. And I mean, everybody's busy. You don't meet people that say, oh, I'm just not that busy. I mean, everybody's busy. That's just the way society is now. But, it's really what you're doing with that time that you have. And I always say it's just very simple. Be kind, listen, be courteous, show empathy, those kind of things. And everything will fall into place. So I think it's just getting the staff members to understand, and we say, you want to treat your patients like you would treat a member of your family. That's basically it.
Right.
So you could, there's no added time. You're just doing these things a little differently and saying things a little differently.
So getting the buy-in, I mean, I think that's part of the challenge, is to convince them that this is not a lot of extra work on their part. It's just some calibration of how they look at the experience with the patient.
Yes, absolutely. It's important that your teams know that we're not just trying to pile extra work on you. Like this isn't another top down corporate's telling you to do this kind of thing. Exactly. It's really just, we want to take care of our patients. We want you to enjoy what you're doing as well. And we're hoping that this is not only, an improvement for the patient, but it's an improvement for, our staff as well.
You had mentioned earlier in a different segment that, you want to make sure you take it one step at a time and not try to do too much. And that could be a challenge too, right?
Yes, yeah, absolutely. You don't ever want to do too much at one time. Everyone has to be on the same page, doing the same thing, and then waiting some time to make sure that you can measure and see if that's working or not. If you do too many things at once, you're not going to know who's doing what and what strategy is working. So it's just really important to take your time, because a lot of the times you just want to, fix and go, and let's do this and let's do that, because everything is just not working, and it's just going to create more. It's just going to be chaos. So it's really important to do one thing at a time, measure, make sure it works, and then continue moving forward, and celebrate your successes along the way.
Absolutely. I mean, these are great points, and I hope our clients and our practices across the country kind of look at this stuff from the perspective of how important the leadership buy-in is, how important it is to kind of take it one-step approach, and making the team members aware that this is not going to take a lot of time. I mean, being nice doesn't take time. Smiling doesn't take time or cost any money. So great topics. Thank you so much.
Thank you.